tell me what happened 15 years ago.
I would need to go on a mission to try to find a drug to save my life. I eventually was diagnosed with this horrible disease called Castleman disease. It's very, very fatal. I even had my last rites read to me. When a doctor tells you, like, we've tried everything, there's nothing else that we can do. Yes, we've tried everything that the medical system knows about, but like that doesn't mean that we've tried everything. If I'm going to be alive because of a repurposed drug, I sort of feel like I owe the universe.
Dr. David Fajgenbaum is a physician and survivor who saved his life
by repurposing a drug and now leads a global hunt for hidden cures.
Tell me about how you're using AI during this whole integration period of drug repurposing.
There are 4,000 drugs, and in total, there are 18,000 diseases. So if you tried every drug and every disease, it would be 75 million tries. Humans can't actually look across 75 million connections. So what we use AI for is to actually give us a score for all 75 million calculations. We've saved thousands of lives with drugs that weren't made for these people's diseases, and they would just be dead if we hadn't repurposed the drugs for them. I shared about Joseph. He was in the ICU with this horrible disease called Pones. It was 100% certain he was going to die if we didn't try the medicine. Across autoimmune diseases, the common variable or the common factor is the immune system, and there are so many drugs that can modulate the immune system in one way or another.
Do you think there's a way of looking at these drugs that could even be potentially connected to cancer?
Yes, but we have to think outside the box. What I try to share in Chasing My Cure is that a big realization I've had is that I didn't actually have to nearly die 5 times to realize that I was in overtime, because the truth is, as tough as it is to hear this, like, we're actually all in overtime. Like, we should all be living life and, playing every day like we're in overtime. So I really hope that this sense of overtime is something that other people can take with them.
Firstly, I want to say thank you to tuning in and listening to the show. It means a huge amount. And connecting with all of you is something that I absolutely love as part of this journey of growing the show. One of my biggest goals of 2025 is doubling the reach of this show. And I can't do that without your support. So I would love to ask you a favor. If you can press subscribe or follow on whichever platform you listen to. This helps us reach more people. And for me, elevating women in science is so fundamental and ethical and scientific information. So if you feel this show empowers you and gives you the information that you've been seeking, I would love to ask a favor in return and to hit that subscribe button and help me reach the goal that I've set for the show of 2025. Thank you. David, welcome to Live Well Be Well.
Thanks so much for having me.
Firstly, I am just very inspired after listening to your story yesterday. And my mentor and dear friend, Dr. William Lee, sent me a message whilst I'm here at TED in Vancouver. And he said, you've got to go and listen to David speak. Obviously, I would have done anyway, but you also should get him on the podcast. So here we are, post your talk where you had a standing ovation, not one dry eye in that theatre. You genuinely did send chills. And I'm not just saying that. I really want everybody who, after this podcast, can go and listen to your TED Talk. I want to start here. You're a doctor. You currently have written a book. You're also making a film.
That's right.
You're also curing so many autoimmune diseases that people feel that there is no answer and no hope to. It's an incredible story. I want to start at the beginning. Tell me about your story, David. Tell me what happened to you. How many years ago was this, the first?
Sure, I was 25 years old, so it was 15 years ago.
15 years ago. So tell me what happened 15 years ago.
So I was a healthy third-year med student. I wanted to become a doctor. My mom passed away from cancer a few years before, and that, for me, just set me on this mission to be a doctor. And I was well on my way. In my third year, I was on my OBGYN rotation, delivered my first baby into the world, which was such a high and high point in one's training. And then everything started to fall apart. And that was that I started feeling more tired than I'd ever felt before, horrible abdominal pain. I noticed like fluid appearing all over my body. I was very healthy. I played American football.
You did put a very good picture up of you, David, I have to say.
That's a good one. Those glory days. But so I went from being just very, very, very healthy to becoming very critically ill while I was in my medical school training. And I ended up taking a medical school exam and then going down the hall to the emergency department. And they started running blood work on me. And they said, David, your liver, your kidneys, your bone marrow, your heart, and your lungs are shutting down. We have to hospitalize you right away. And within a couple of days, I was in the ICU. And very quickly went from like very healthy, like I said, to literally dying. Retinal hemorrhage made me temporarily blind in my left eye. And I spent weeks, like drifting in and out of consciousness. No diagnosis, by the way. We didn't know what it was. And I eventually was diagnosed with this horrible disease called Castleman disease, where your immune system attacks your vital organs and shuts them down, and you die from the disease. It's very, very fatal. And back then, there were no approved treatments, but my doctors decided to try a number of chemotherapies on me. The hope was that we don't know what's going on or how this disease works, but maybe if we just like kill all of your immune cells, like maybe that'll work. And let's use like the 7 worst chemotherapies out there. And I got those combination 7 chemotherapies, and they did work. And amazingly, I was so sick, I actually felt better while I got the chemos because they were like actually controlling my disease. But I kept relapsing. And so they kept giving me chemo, and then I'd relapse, and chemo, and I'd relapse. And I tried to go back to med school, and then I would relapse. But I guess my journey really changed with my 3rd relapse. So the 4th time I almost died. And by the way, I even had my last rites read to me during one of these. And that's when I realized that if I was going to hope and dream and wish for a future with my girlfriend at the time, Caitlin, and a future where I could be taking care of patients, that I couldn't just hope that some doctor would figure out what was going on and maybe find a drug for me. I would need to go on a mission to try to find a drug to save my life. And I had this really clear realization that like, all right, David, that sounds good that you're going to go find a drug to save your life, but like, you don't have $1 billion in 15 years to do it. Like, and then it's like, okay, well then what can I possibly do? And it became very clear to me that the only way I could save my life is if I could find a drug that already existed that could maybe work for me. And so I went out on this search, and I did a bunch of work in the lab, and I actually didn't share during my talk yesterday, but I failed twice where I thought 2 drugs would work, and I tried them on me and they didn't work, and I relapsed anyway. And so it was actually the 3rd drug that I ended up testing on myself that was made for organ transplant rejection, and it worked. I nearly died 5 times in the 3 years before I started taking it, and then it's now been over 11 years that I've been in remission.
It's amazing.
It's just crazy.
There is so much hope in your story. And I think that's what everyone connected to in that theatre yesterday is hope, but your sheer determination. And I don't know if there's anyone listening to this that has been diagnosed with an autoimmune condition where they feel very unhopeful.
Yes.
What lit that fire in you?
I think it was a few things. I had just the most incredible mom. I mentioned she passed away when I was in college. She was just such an optimistic, positive person that definitely got passed on to me in both just the time I spent with her, but also I think there was some genetic aspects of the hope that she just brought with her in her day-to-day life. And then for me, what really drove me was just this desire to be alive and to be with my girlfriend, Caitlin. I wanted to have a family with her. I'd promised my mom that I would become a doctor and I would treat patients. And I was determined that I could develop a drug in my career. Like maybe I could develop a single drug in the cancer world that could save patients. And so I had these things that I wanted to do. And I think that anytime you face a challenge in life, I think that the only way, at least for me, the only way I can really take on a challenge is if I have a vision for the thing that I'm fighting for. So you can't, at least for me, day-to-day breathing was really tough. My lungs were filled with fluid. It was painful. It was like getting stabbed to just take breaths. But I kept fighting for every breath because I had this vision for the future. It was like I could see myself with Caitlin. I could see us with having kids and a family. I could see myself treating patients and discovering a drug that could save lives. And those things were just constantly on my mind. So it was like, all right, I'm going to take each breath. Every breath's going to feel like I'm getting stabbed, but it's, one breath at a time, right? Because of that vision. And I think that you got to have a vision, at least for me, the 3 things. You got to have a clear vision for what you're working towards. You've got to have an amazing group of people around you supporting you. So I had my sisters and my dad and my girlfriend and friends that were just always there for me that I could lean on for their strength. And the 3rd thing is, it's cliche, but I think you have to take it one step or one breath at a time. If you told me, David, you're going to be in the ICU for 6 months and it's going to be literally living hell and just torture for those 6 months. If you told me that on day 1 or even halfway through it, I would be like, no way I'm going to do this. I'm going to give up and I'm going to let go. But it was like, I didn't know it was going to be 6 months of that. I at least knew I could take like one breath at a time. So I can handle this. I can handle the next one. And I think that between those things, the vision, the support, and then the one step at a time, I think we can take on anything.
It's really inspiring to hear because I think, one, you being in this field, you know that you can try and get to work. But when you're in that mindset, when you're in hospital, it's a different thing.
That's right. And I think that, I was lucky, as you said, I was already in the medical field. I was a third year med student. So I was very fortunate that I was in it, because if you're not in the medical field and all of a sudden you get exposed to the medical field, it's frightening and terrifying. And of course, you know how my journey went, and that's that I was so thankful that I was able to save my life with a drug that was already there, that now my life is all about how do I find more of these drugs out there, so that if you or someone you love ends up in the hospital with a horrible disease, that we've already identified a drug that can save you.
Because your work now focuses on drug repurposing.
That's right.
Right? So you said something yesterday where there's 400 diseases.
4,000.
4,000?
No. Sorry, 4,000 approved drugs.
Yeah.
Sorry, yes.
And 400. So is it 400 or 4,000 diseases and the exact same number of drugs to match, right?
It's 4,000, yep.
Okay. And how many diseases are there, autoimmune diseases, that are kind of don't have these drugs matched?
There's a lot of autoimmune diseases that don't have a treatment for them. There's approved. And exactly, yesterday we were talking about how there may not be an approved drug for your autoimmune disease, but there might be an approved drug for another autoimmune disease, or maybe an approved drug for a cancer or for transplant rejection. And all of them work on the immune system. And so they might actually work for your autoimmune disease. And so that's where all I can think about is how do we use those 4,000 approved drugs that we have that are currently approved for 4,000 diseases, but how do we use them for the diseases that don't have any treatments, like these autoimmune diseases you mentioned?
What got you onto this train of thinking? Because obviously you said, I don't have $1 million.
$1 billion,
and all of this kind of research into how we repurpose a brand new drug for this disease. So how did your mindset go from, okay, I'm going to go into drug repurposing and have the confidence to start going down that route? Like, what was that initial?
Yeah, I mean, for me, it was really it was the realization that was my only route to finding a drug that could save me would be to repurpose an existing medicine. I didn't have the resources, I didn't have the time to create a new drug, and I wouldn't have anyway. I mean, it's so hard and challenging. But to me, it became so simple. I was like, what if that, other drug over there, that could work for me? And the real driver for that was that those chemotherapies I was getting, they weren't made for Castleman disease. They were made for other diseases. And so my doctors, they're telling me, well, there's nothing left for Castleman's. I'm like, well, you tried those 7 chemotherapies and they didn't work long term. I kept relapsing. So they weren't like the cure. But if they could work short term, maybe there's another drug for another disease that could also work short term or long term. And so this idea that, like, when a doctor tells you, like, we've tried everything, there's nothing else that we can do. Yes, we've tried everything that the medical system knows about, but like that doesn't mean that we've tried everything. And so that for me, and then when I discovered this drug that could save me sirolimus, and months started passing by, and it wasn't until we were at like 38 months before I started counting in years, right? Because it was like, I just didn't know how long this remission would last. It was like, counting by the month, and every month just, afraid if I would relapse. But the months have added up. Now it's 11 years. But as the time went by, it just became so clear to me that, oh my gosh, I've just stumbled upon this incredible, realization. And that's that we can save a lot of lives today and tomorrow with the things that we already have. We're so forward looking. What's the next drug? And I think that the other thing that really resonated, or just was so clear to me, was that a lot of this has to do with financial incentives. And that's that all drugs become generic within 8 to 12 years of becoming approved. And once a drug is generic, you can make tons and tons of different versions of it, or different companies can make copies of it. And so no one makes any profit once it's generic. And so that means that 80% of our drugs that we have, they're all generic, so no one makes any profit off of it. So even if you found a life-saving use for one of these old 80% of drugs that could treat millions of people, literally no one in our whole system is incentivized to do anything about it. And so what that means is there's all these opportunities out there to use these old, safe, inexpensive drugs in new ways, but no one with any motivation to do the work.
11 years on, do you have an understanding of how this drug has saved your life?
I do, yeah. So this drug, it's approved for organ transplant rejection. And the way that it does that is, so like if you were to get a kidney transplant, your immune system would notice that it's a kidney from someone else, and it would start to try to sense and understand, like, what is this foreign object? And it would turn on something called the mTOR communication line. And mTOR is a way that immune cells communicate with one another and basically say, like, this is bad. Like, I just found something. I don't know what it is. It might be a kidney, but I don't know. But it's something bad. And then now all these immune cells, they start telling one another, like, hit the mTOR switch. And that tells them to start proliferating, to start multiplying, and to start getting into an attack mode. Well, sirolimus, the drug I'm on, works by turning off mTOR. And so even if you were to get that kidney and now your immune cells go and they're looking at this kidney to try to figure out, what is this thing? If you're on an mTOR inhibitor and it goes to turn on its mTOR switch to say, let's fight this thing, it can't. And so that way you can have a healthy kidney that got transplanted in you and you don't attack it. Well, it does the same thing in my body because the reason I decided to try sirolimus is because I discovered that communication line mTOR was turned into overdrive in my immune system, and I didn't get a transplant. Like there was no, I have 2 normal kidneys for me. There was no organ in me for them to reject, but the immune system was on as though there was something to fight. And by turning off mTOR, that's gotten my immune system back into this sort of like surveillance mode, and it means that my immune system's weak, and so I can, get very bad infections very quickly, and I have to worry about that sort of stuff. But I've been very fortunate. I'm going to knock on some wood.
Yeah, well done. I'm going to knock on wood for
thank
you. I think it's completely fascinating that you're now on this journey. There was somebody in the audience yesterday. So post this, you've got to set up 2 not-for-profits. It's incredible to have a doctor here who has saved his own life himself by looking at a new way of drug treatment and repurposing and not having to find a new drug each time. But now your mission to do this for so many other people who feel unhopeful.
Yeah. And for me, it was, wow, okay, it worked for me. Maybe we got lucky. And then I joined the faculty at University of Pennsylvania, and we kept doing this kind of research. And then we discovered a treatment that could be repurposed for Poem syndrome, and one for angiosarcoma, and another one for one form of Castleman's and another form of Castleman's. And all of a sudden, we're like, maybe we're not just getting lucky. Maybe there's a lot of things out there. And the contrast of it is that we've got people who are alive today because of drugs we repurposed for them. If we hadn't repurposed it for them, they wouldn't be alive. But then I also start thinking, well, what about all the people before them? For the last 10, 15, 20 years since that drug came out for this one disease, all these people suffered and died when there was a drug that was at their pharmacy. Just no one knew that it could work on their disease. And so it creates this, for me, this tremendous sense of responsibility and purpose and sense of urgency that there's drugs out there that could help people, and there's people who are suffering, and there's no one doing the matching, and someone has to do it. And if I'm going to, be alive because of a repurposed drug, I sort of feel like I owe the universe. I should be doing the matching, right? Because I've come across this thing that's literally, we've saved thousands of lives with drugs that weren't made for these people's diseases, and they would just be dead if we hadn't repurposed the drugs for them. So it's oh my gosh, how many more are out there? And so that's why almost 3 years ago, we set up a nonprofit called Every Cure, which is on this just huge mission, very audacious mission, to unlock the full potential of every approved drug to treat every disease that it possibly can, so that we don't just have, one drug is approved for 1 or 2 diseases, but let's find all the diseases that can benefit. And we are just all in on it.
I've spent years in the fashion industry, but also years as a scientist trying to understand how our bodies are meant to move. And I'll be honest with you, most shoes are terrible for our feet. I know this firsthand. For years, I wore the wrong shoes, ones that looked great, but in reality gave me persistent back pain and messed up toenails. I searched everywhere for a pair of shoes that wouldn't just support my feet, but would also help them heal. And I struggled because most healthy shoes don't exactly scream style. And then I found Vivo Barefoot, something that finally looks good and actually works. I wear mine with cargo pants, awesome leather trousers, a crisp white tee, and my favorite sunnies. Not only do they feel great, but they really fit my style. Wide, thin, and flexible, these shoes allow my feet to move naturally the way they're supposed to. And the best part, just 6 months of barefoot shoes can increase your foot strength by 60%, helping to undo the years of damage from conventional footwear. Now, if you've ever had the same problem and tried to find a shoe that supports your body without sacrificing style, then this is it. Try Vivo Barefoot for yourself and feel the difference. You can get 20% off if you use the code LWBW20 at vivobarefoot.com, where the T's and C's apply. Trust me, your feet, your back, and your outfit will thank you.
How are you using AI in this whole system? Because this has been the biggest topic of today. And we've just listened to Sam Alderman speak, right? So OpenAI. And there's been a mixed bag. This is the thing that TED brings, right? Controversy. It brings two camps. Yours feels very hopeful with AI. Tell me about how you're using AI during this whole integration period of drug repurposing.
Sure. So we use AI to scan across everything the world knows about every drug and every disease, and then to look for the points of connection between drugs and diseases. So I shared about how Viagra is very famous for having gone from being a treatment for heart disease to its well-known use. But interestingly, it also treats a rare pediatric lung disease because these kids were dying because they weren't getting enough blood flow to their lungs. Well, Viagra is very good at increasing blood flow. And so it can increase blood flow to the lungs of these kids, and they live full lives on Viagra. And so what AI can do is the point of connection there between pulmonary arterial hypertension, which is that pediatric illness, and erectile dysfunction and heart disease is increasing blood flow. And so what artificial intelligence can do is it can look for those points of connection between drugs and diseases. What's a similarity between two diseases, or maybe a similarity between two drugs? And can we find a mutual connection between them? And this is the kind of stuff that humans can do. We can make those connections. I mean, the sirolimus example, what I did for myself, that was like, okay, I found too high of mTOR in my immune cells. What other diseases have too high of mTOR? Okay, organ transplantation. What drug treats organ transplantation? Okay, sirolimus does. Well, then maybe sirolimus can treat Castleman disease. So us humans, we can do that. The reason we really need AI is that there are 4,000 drugs, and in total, there are 18,000 diseases. And so if you tried every drug and every disease, it would be 75 million tries. And so like us humans can't actually look across 75 million connections and be like, oh, that looks good or that doesn't look as good. And so what we use AI for is to actually give us a score for all 75 million calculations. So if you tried every drug for every disease, and then us humans can look at the things at the top and be like, what are the things that are scoring 0.99? Wow, this looks really promising. Let's look into it further. And then, so that's what our nonprofit does, is that once with the things that score really highly by our AI algorithm, we get really smart humans to look at them and say, wow, should we do some more laboratory work? Should we do clinical trials? Or should we just go right to raising awareness because this looks so promising?
So where are you on this kind of side of things? Because I think anytime somebody thinks about trying a new drug or a new treatment, we think about clinical trials, right?
Yeah.
We're kind of going phase 1, phase 2, phase 3. We go through these different areas of efficacy. Where are you on, I mean, I guess people, when they feel like they've got no hope, will want to do anything, like exactly where you are. And the interesting thing that you have that I don't want to say not many doctors do, but you've been through it.
Yes.
So you've got this relatability, you've got the understanding of where that person is feeling because you've been there. Where are you now in kind of like that phase of giving this out to people? Because obviously, as you said, the efficacy is such an interesting standpoint here. So where is that?
It's such a great question, and it's so gray and so complicated. And I think it's easy to look at the ends of the spectrum. So like if someone is in the ICU and they're dying from a disease, and I shared about Joseph. Joseph was here yesterday.
I really want to talk about him, by the way.
He's amazing. So he had just celebrated his 30th birthday. He was in the ICU with this horrible disease called POEMS. He was dying. We recommended 3 drugs that are made for a similar disease called multiple myeloma. And this is an example where he was going to be taken off life support on a Monday, and we were talking to his doctor on a Saturday. And so it was 100% certain he was going to die if we didn't try the medicine. And so I think most people would say like it's 3 medicines that are similar to the disease that he already has, that have been used for a disease similar to the one he has, and he's going to die on Monday. We should try them. I think most people would agree that like you should do that. And it's young, amazing person, all the reasons to do that. And then the other spectrum would be like saying, I think chemotherapy is going to treat attention deficit hyperactivity disorder, which is not a deadly condition, but I think these chemotherapies can do it. I'm not going to do a clinical trial. I'm just going to start prescribing, 7 chemotherapies to treat ADHD. That I think most of us agree like that you shouldn't do that. Like you should do clinical trials. Like if it's going to help kids with ADHD, like it's worth it. But like the risk benefit of giving horrible chemos that could actually kill you for someone that has a condition that isn't deadly. Not to say that ADHD is not something we need to control, but I don't think any of us want to use chemotherapy for it, right? But the challenge is there's a lot of grayness in the middle, right? Those are the absolutes I think we all agree on. What's interesting is in our system, a lot of us assume that the FDA or the EMA are basically putting a stamp of approval on every drug for every disease the drug can work in. But the way that it actually works in our system is that the FDA or the EMA will approve a drug for its first use, and now it's on the market. And in order to then get it approved for another use, that drug company has to apply to the FDA or the EMA and say, like, I think this drug can treat this other disease. But if they don't apply for that new approval, doctors can prescribe it in what's called off-label. They can prescribe it for other diseases off-label. And it turns out doctors do a lot of that because drug companies just, frankly, they don't really profit from adding many more diseases to their label, especially when it's generic. So they're not doing the work to prove that it works in these other diseases. So doctors are prescribing things off label all the time. So all that to say is that it's really great. Like they're already doing this sort of in-between stuff where they're prescribing things when it's not approved for that use. Sometimes there is a trial, sometimes there isn't a trial, but the practice of medicine is so complicated. And it really at the end of the day comes down to the doctor and their patient deciding what's the right risk benefit. So I guess where do I stand? That's that where I stand is that doctors are already prescribing things off label. They're already making these risk benefit calculations, but they're doing it based on limited data because there's no entity that's out there doing clinical trials or doing the lab work or really evaluating these things to help them. So I see our role as finding the really promising things with our AI platform and then doing the work to help doctors to know which are the things that I should actually prescribe versus not prescribe.
I think like thinking about the connections, I mean, even in the UK, knowing your work, Castleman's disease, if somebody had that now in the UK, would they automatically use the drug that you would use? Like, how do you get this information so widespread to doctors? Because I do think there is that conversation that you said very early on where a doctor goes, there's nothing more that we can do. And if people don't know about you and the work that you're doing, like, how do we get this information or connect it more to doctors?
Well, I'm so glad you asked that because you're exactly right. We can do all the clinical trials we want. We can prove all this stuff all we want. And if we don't get the message out, it does no good, which is partly why I'm so excited to be on a podcast with you today. Because seriously, like getting this out is literally life-saving and life-changing. Yeah. I mean, I shared yesterday about leucovorin, this vitamin derivative that can help a large portion of kids with autism to improve their speech and their verbal communication, but you have to get the word out about it.
Tell me about this because this was phenomenal.
Oh my gosh, it's incredible. So I shared about how our AI platform finds these connections, like I mentioned, but sometimes our platform just uncovers connections that are already there, just no one's working on them. And so it turns out that a large portion of kids with autism, it's somewhere between 50 and 70% of children with autism, have antibodies that prevent folate from getting in their brain. We all need folate for healthy brain development. Folate is a vitamin that we all need to consume, and one of the main places where you want it to get is into the brain for brain development. But if a large portion of kids with autism have these antibodies that prevent it from getting in the brain, that means that they're not getting this important vitamin in their brain. And no one has really known what that means for these kids until a researcher in the US named Richard Fry did the first of now 3 clinical trials where he gave not folate, but gave a derivative of folate called folinic acid to kids. And what he found was that the kids that got folinic acid had a significant improvement in their verbal communication and their speech, how they communicate with the world verbally, which is really striking. It suggests that the folate deficiency is really contributing to the challenges for speech in a lot of kids with autism.
That mind blows me because obviously folate is a B vitamin.
Yes.
And is it just that it's a supplement deficiency because obviously the antibodies and that we should just be giving kids now folate from a young age? Or is it the fact that there was like a enzyme inhibitor or something that was going with it? Like it's
a great question. So if you could give all the folate you want and these kids will not get any folate in their brain because basically there's like a barricade at the barrier between the brain and the blood, which says that like basically because of this antibody, you just can't get folate across. Like no matter, you could give all the folate you want, you won't get any across. But if you give folinic acid, there's another channel called the reduced folate channel, the RFC. And so folinic acid can go through the RFC. Folate has to go through the folate receptor alpha. And so basically it's this incredible thing where like you don't get folate in if you give all the folate you want, but if you give folinic acid, which is like a little slight derivative, it's called a reduced form of folate, it gets in the brain. And then these children have improvement in speech. And the reason this, is so just touching and so important is that the clinical trials have shown improvement. And then we've heard stories of kids that have gone from being nonverbal to beginning to say their first words, or maybe they could say a few words and be able to share a statement or a feeling. And we get so passionate about it because the 3 clinical trials have already been done. One was done in the US, one was done in France, and one was recently done in India. And so what are we waiting for is sort of how I think about it. And I understand that a 4th trial would be good. And I think it's always better to generate more evidence. but this is a vitamin derivative. And so, and there's actually even a blood test that can help you to determine which patients are likely to respond. You can figure out who has the antibodies in the blood. And then if you have the antibody, you're more likely to respond. And so it just seems like the kind of thing where it's really about awareness raising. And that's why, again, I'm so happy to be on a podcast with someone like yourself who helps to share such amazing information with so many people. I think it's about doing good science, but then it's also about communicating about it.
Autism is hugely on the rise, more than ever before. And we're trying to figure out ways of like, why is this coming up? Is it coming up in birth? Is it coming up from gestational diabetes from the mother? Like there's so many like conversations on why there's such a rise in autism and even ADHD as well, or ADD.
Yes.
And having such a simple formula, you know, as what you said, it's literally a vitamin deficiency.
Yes.
It's mad that that's not even come up on my show before, this conversation. You know, we've had so many people come on here and talk about autism and nutrition and mental health, and that's not even come across my avenue. I've
been so shocked. The more I look at this and I find these clear papers, and in fact, they'll do lumbar punctures where you actually get the fluid out of your spine to see how much folate's in the brain, and these kids have no folate at all. And it's like, how have we known this for all this time? And there's a simple solution, 3 clinical trials. So I'm also trying to wrap my head around, I'm like, how has this been missed? But it also, you know, it's depressing that it's been missed, but the positive side of it is to say that, okay, we can do something about this. We can make a difference. And also, how many other conditions are out there where maybe a vitamin deficiency could contribute to them that we could actually overcome?
So how are you now getting this out? I mean, obviously we're doing a lot here. We're doing TED, we're doing the show, you're running a book. I mean, you are also doing a film.
That's right.
Which is incredible. And before I get on to that, which I really want to ask about, how are you now speaking to doctors about this day in, day out? Because I can imagine there's more people that are hearing, more people are coming to you. How are you keeping up with that kind of intercommunication with this in the medical field?
It's a really great question. And we're really trying to figure out how to do it the best way we can. Because I have to admit, when we first built Every Cure 2 years ago, I thought it was going to be all laboratory studies, clinical trials, and like 3 or 4 years before we were in the world of like changing how you treat patients. But we've just started coming across these things that we feel this moral obligation to start to get the word out about. So we're still trying to figure out exactly how we create the right communication channels. But by the end of this year, I'm really hopeful we can do a full-blown multi-channel marketing campaign where colleagues like you and friends, we're like all raising awareness. Like, and it's not about saying you should take this medicine. It's about you should be aware of this test. You should be aware of this vitamin. And I think that we need to be really thoughtful. So if there's any listeners or viewers that have ideas for ways to market and get the word out, I love them, because I think that this is so non-traditional. There's never been a nonprofit drug organization like ours that doesn't make any money off of any sales. We're just here to help people. So there's not really a good blueprint for us to go off of, but it's going to take working with people like you and Dr. Lee and others to get the word out. And so, yes, like I said, I love any ideas that you have.
Well, I think it's like, you know, even somebody hearing, you know, the pharmaceutical industry and not-for-profit has never gone hand in hand before.
Never.
This is like, it's like an anomaly that's sitting here, right? And you're basically like, we have all of these amazing resources and they are so underutilized, which is the opposite of what you think about when you think about the pharmaceutical industry, right? You're thinking like we're plowing all of these like billions of dollars into creating drugs, yet we've got all of these drugs sitting here. Something that has just come into my mind, and you can tell me if this is completely crazy, but I spoke to an incredible immunologist on this show recently. His name is Professor Dan Nicolou. I don't know if you know him. He's at Imperial. He's done incredible research into breast cancer, but as well as looking at the immune system and the brain and how they work together. And I was fascinated by his work. And he terms cancer an autoimmune disease.
Wow. Yeah. I mean, so I've never heard of that. It's fascinating. Certainly, I am 100% of the mindset that cancer is certainly a disease where the immune system plays a very important role, both in surveillance, you know, once the cancer begins to develop, but also in trying to treat it and control it. But I think that's a really interesting way and provocative. I'll have to look his stuff up. That's really interesting.
I think you are going to have to, because I'm just thinking about the drugs, right?
Yep.
So chemotherapy and radiotherapy is normally what's delivered when you have cancer treatment. Post-surgery, you cut it out and then you treat. It's a really hard treatment. And I know I speak to a lot to Dr. William Lee about his thoughts around chemotherapy. And as you said, you're basically just obliterating
every
single immune cell in your body. I'm going very far-fetched here, but I like to do that. Do you think there's a way of looking at these drugs that could even be potentially connected to cancer?
Yes. In fact, one of our lead projects is around the numbing medicine lidocaine. So, what you get when you go to the dentist or you have any sort of procedure, and the cancer-killing properties of lidocaine. And so actually directly injecting lidocaine into tumors. And this is actually based on a lot of laboratory research and one really important clinical trial that was done in India. It was published about a year ago, where injecting lidocaine directly into a breast tumor before the tumor was removed resulted in a 29% reduction in mortality at 5 years. So those women who had lidocaine, the simplest, cheapest, most inert substance that you could possibly inject into the body. And actually, by the way, it's already injected during every surgery at the site of the incision. So it's not like you're even introducing a new substance. They're already going to be using lidocaine during the surgery. We're just saying inject the lidocaine around the tumor at 6 sites, had this massive reduction in mortality. I would like to see that study repeated, because there's, confounders and that sort of stuff. But we are running full speed after trying to understand how might this work? What's the mechanisms through which lidocaine might kill breast cancer, and what other cancers could it potentially kill? Because if it could, lidocaine is one of the few substances that we have so much data on injecting it all over the body, and we know that it doesn't cause long-term harm. And so if it is the kind of thing that actually can, even if it just reduces mortality by not as much as 29%, but 5 or 10%, it's such an inert substance that it would be a game changer for a lot of cancers. And so this is an example where no one in a million years have been like, oh, let's put that, numbing medicine from your dentist into your tumor. It seems so far-fetched. But as you learn more and more about biology, you learn that there's so much overlap between, as your colleague was mentioning, how cancer may develop and how an autoimmune disease develop and how they might be interconnected. And so it's really amazing. But we have to think outside the box. It can't be, oh, well, that's a numbing medicine. It couldn't treat cancer. Well, it's a medicine that's used for numbing, but it also might be medicine that's used for killing cancer.
Absolutely. Well, you mentioned Viagra earlier,
Yes.
right? And I've got Raynaud's disease. And so one of the treatments, I haven't tried it, but Viagra is one of them because it increases blood flow, and fluoxetine, the SSRI, am I saying that correctly? That's another one that kind of dilates and opens the blood vessels.
That's right.
And it's really interesting that when they're presenting you with your treatment options, they're like, well, these are all the other drugs that you can take. And I'm going, wait, Viagra? Isn't that for erectile dysfunction? Or wait, isn't that for depression?
Yeah.
But they use it in such smaller quantities. And that was kind of my first world into understanding drug repurposing.
I love that. And as you know, it's not approved for Raynaud's. These are not approved, but doctors are doing it. And so that's why I sometimes have a challenge when doctors will say, oh, I'm not going to prescribe it because it's not approved for that. And it's like, well, 1 out of the other 4 prescriptions that you wrote today are for things that it's not approved for. So they're already doing it. And I love hearing that your doctors presented those because, like I said, some doctors are much more, well, this is what's approved and this is not. I'm not going to do this. Yeah,
that's really hard. And I do think there is, I'm hoping that more with the health that is coming to the forefront, more shows, podcasts, people writing books on these things, doctors are getting more of a holistic view on not just the one avenue that you're going to go down. So talk to me about chasing my cure as I'm looking at this. I feel very privileged to have this book in my hands. Talk to me about writing this.
Sure. So I wrote it back in 2017 when I discovered this drug that saved my life in early 2014. And so I was just, about 3 years or so in remission. And so I was still totally terrified, every day that this thing was going to come back. I just every day that went by felt like a gift, but it also was just one day closer to relapse. And so I started to write it. The New York Times ran a story, and that led to interest from a number of publishers, and they suggested I write this book. And I'm really happy I did because I learned so many lessons about life from nearly dying 5 times. So I'd always wanted to share those lessons, but I also felt like, well, I don't know how long this remission is going to be. Am I going to spend all this time writing this book? And then, I lost that time with my girlfriend or wife at the time, Caitlin, and we didn't have any children, but it was a big challenge for me to figure out how I was going to spend my time. And I eventually decided, okay, I'm going to write the book because I think that these lessons I learned needed to be shared. And if I do end up relapsing and I do end up dying in the short term, it is a way to share those lessons beyond my time. It ended up, I also, run this research lab and this nonprofit. So I didn't want to do it if it would get in the way of our work and our mission. So I told the publisher that I would work on it every Saturday and every Sunday for about 10 hours each day, but I wouldn't touch it during the week. It would just be, 20 hours every weekend, and then the publisher and the editor would be able to work on it during the week, and then I'd work on it the next weekend. So it was a full year of every Saturday and Sunday. And my poor wife, it was the year before our daughter was born. Our daughter was born on August 19th of 2018, and for that whole year until August 1st of that year, every weekend, every Saturday, every Sunday was spent the full days working on this book. But thankfully, I did get it, written before my daughter arrived, because then I could, be able to spend more time with her and with Caitlin. So wrote the book, and actually when that New York Times story ran was when I first met Wendy Feinerman. Wendy was the producer of Forrest Gump and Devil Wears Prada, and she's done a bunch of other amazing films. And so at the same time that there was book interest, she reached out, and she actually came and sat with me during an infusion. I take these immunosuppressants every day, and I also get an infusion every couple of months to like really control my immune system. And she sat with me during an infusion for like 3 hours, and we just connected on a million levels. And she told me, she said, David, I want to turn your story into a movie, and I want you to write the book first, because then we can base it on the book, and that way we don't have to write a whole screenplay based on interviews with you, but you write the book, and then we'll try to turn this thing into a movie. And so here we are, signed a contract at the end of last year, and now we've got script, and we're trying to turn this thing into a film.
When can we see it?
I think it'll probably still be at least a couple of years. We still don't have a lead actor yet, and of course, we like to joke about.
You don't want to do that as well?
Definitely not. Definitely not. No, definitely not that. But we definitely joke about who that should be and who it shouldn't be. I'm a huge Sacha Baron Cohen fan, and so a dream would be for him to play. But I don't know if that would be the right.
We're putting out a call for Sacha Baron Cohen, please.
Please play me in this film.
That would be amazing. Well, I love that you've already put that out, because, who knows, Sacha might be listening to this podcast.
Amazing. I would love that.
And he might say yes. So nearly dying 5 times, just that sentence, it holds a lot. What's been like one of the biggest things that you've learned through this?
Yeah, gosh, it's so hard to just boil it down to one thing, because there have been so many different lessons, but I think maybe the one that stands out is that when I had my last rites read to me and I nearly died the first time, this is when I was 25 years old, I said goodbye to everyone, and I prepared for death, because you don't ever get you don't think you're gonna get a second chance. You certainly don't think you'll get 5 chances. But after that first one, I noticed this change in me, and that was the closest thing I could think about to the feeling I had was from back when I used to play American football, and we would go into overtime of games. And so overtime, of course, is when the score's tied and you've got time you didn't think that you'd have. And in overtime, there's this insane clarity. Like, you're so focused, because if you mess up and the other team scores, the game's over. Whereas like in the beginning of the game, there's sort of like this, like, you can maybe not be as focused. You can mess up, you can throw a bad pass, and like you'll make it up. But in overtime, there's this incredible clarity of purpose. It's like every second, every step counts. And all of a sudden I came out of this, first time I nearly died, and I was like, oh my gosh, I feel like I used to when I played football in overtime. Like, every second counts, and that can be really scary. Like, sometimes when you're in overtime, it's really nerve-wracking. You're like, 'cause we could lose this game. We fought so hard all game, and we're going to lose. But it can create incredible clarity, like crystal clarity. And so for me, I have this incredible clarity on exactly what I want to do and exactly how I want to spend my time, because of going through what I've gone through. It also sort of gives you permission to like not do things you don't want to do. You're like, maybe beforehand it's like, yeah, I don't have time for that. Exactly. That's exactly what it is. I don't have time for that. And it's like, and maybe before I might have felt guilty. Oh, this person's nice, I should do this thing. Like, no, like you got to do what's really important to you. And of course, now I'm in like an 11-year overtime, and like at some point you'd think that maybe I wouldn't be so intense, but it gives you this extra lease on life, and gosh, you want to make the most of it. And so what I try to share in Chasing My Cure is that a big realization I've had is that I didn't actually have to nearly die 5 times to realize that I was in overtime. Because the truth is, as tough as it is to hear this, like, we're actually all in overtime. Like, we should all be living life and, playing every day like we're in overtime. Not that, I know the cliche is like, live it like it's your last. And maybe it is going to be our last. For most of us, fortunately, every day is not going to be our last, thankfully. But it doesn't mean we shouldn't be living it with, just total clarity on doing the things that we think are important in life. So I really hope that this sense of overtime is something that other people can take with them.
I think that's so beautiful because you wake up every day with hope, right,
Yes.
in your day.
Yes.
And I think it's hard for one to wake up with a positive mindset every day, but waking up with gratitude
Yes.
can help us get there.
I think you're right. I think the gratitude piece is such a big part of this.
It's such a big thing because we are here for such a finite amount of time.
Yep.
And I think when you go through what you go through, you realize that at any moment that can be taken away. And how lucky and how actually, like, there's such a small chance that we're actually here on Earth.
It's amazing, isn't it?
It's such a small percentage. I can't remember what the actual percentage was, but it's something
crazy,
mind-blowing. And so the fact that you've gone through this continuously, it is one of those things that I always think that when anyone's close to death or is elderly and know that their time's up, they have all this clarity and wisdom.
Yes.
And there is so much that I'd love to distill from every single person who's gone through that, because you are faced with the inevitable, this might be it. And you're kind of forced to think about these things in a new perspective.
Exactly. And for me, my hope is that, like, can we all start thinking about them now, right? Like, let's let my pain and my suffering and my last rites and all that stuff, like, let that inform you now, so that way you don't have to go through all that stuff that I went through. Like, I already went through it. Like, trust me, it's rough. It gives you clarity. Like, life is short. Like, you should love it. You just have so much gratitude for it. You should wake up every day being so grateful for every moment. And, like, it's a beautiful day. The sun's out. Like, just trust me. But then, like, let's all just live that way. Let's all live with this sense of overtime, the sense of purpose, the sense of clarity. And I love that you used gratitude and hope, because you could have clarity about how you want to spend your time, but if you're not grateful for the time you have, if you're not hopeful about what can be, and you're just, gloom and doom, like, oh, life's short and it's, I'm not going to make the most of it. I'm just going to sort of, like, deal with the gloom and doom. So I think you're right. It's not just a sense of overtime. I think it's combining that overtime sense with hopefulness and gratitude. And when you can bring those together, it can create a really fulfilling life.
Obviously, the drug is what saved your life and your incredible determination. But it really sounds to me, and something that I'm very passionate about, is compassion. And I think when you have that, you have a lot of clarity to where you want to go. And it sounds like you had this such deterministic mindset where you were like, I am not going to let this stop me. I'm not going to give up. And I think that ultimately is, like, part of the prescription that sounds like it really did save you.
You're exactly right. Yeah, you're right. There's a lot of different prescriptions, ingredients, sort of how it all comes together. And I agree with you. I think that having that clarity of purpose, what are you working towards? So for me, I could, like, picture Caitlin and I could picture kids, and I don't know if those visions are exactly what my two kids are now, but gosh, do I have the two sweetest, most amazing kids. I have a 3-year-old and a 6-year-old. They're beyond my wildest dreams. But having that clarity was only one part. Like, you can have a vision, but unless you've got just people loving you and supporting you and giving you strength. And for me, it was like, gosh, like, I don't want to breathe anymore. I don't want the pain, but, like, I don't want them to have to go through the pain of me not being here. So I'm going to keep fighting. So, like, that support's so important. And that third piece, like you said, is the determination. You've just got to keep grinding. You just got to keep fighting for it. And I was chatting with one of my best friends, Grant. We were talking about how much value and satisfaction comes from, like, getting through the tough moments, especially on a team. Like, we run Every Cure, and we've gone through challenges over these years, and getting through really hard moments with people you care about creates a bond that is just, like, it's unbreakable.
It's unbreakable. The hardest moments bring, I think, the most love.
I totally agree.
And the most transformation. I mean, you've been through the biggest transformational journey, I think, of anyone who's ever sat in this seat opposite me. And I'm incredibly grateful that you decided to share your story openly, because I can imagine it's not an easy thing. It takes a lot of time to process, and then being able to process and tell it so eloquently, but then also have such a purpose to help and save so many lives. Like, can I just say, how many have you saved to date?
It's in the thousands, which just feels insane, because, like, each one of those, and you saw Joseph yesterday, each one of those brings me to tears and gives me just, like, the most incredible joy. And what has been so clear to me lately, what just touches me the most is when I hear about what these people have done in their lives, after we've saved them. So I shared that Joseph and his girlfriend Tara are now planning their wedding. And I shared about Kyla yesterday, who just began her freshman year of nursing school. She wants to be a nurse because of all she went through with her health issues. And she's, doing great. Michael, who walked his son down the aisle on his wedding day 8 years after we repurposed a drug to treat his cancer. And so it's not just the lives and the years. It's like being there with your son on his wedding day. Like, what's more important than that? 8 years after doctors were like, this is it. You get to start your freshman year of college. Like, these are marry the person you love. This is why we need to save people. And this is why, we want to save them for years and years and years. But it's not just the saving. It's like, it's the what you enable and what you create, or you enabled to happen after you save them.
So anyone who's listening to this that is a doctor in the medical profession, or has someone that they love, or is somebody themselves that has an autoimmune disease or any chronic disease, let's just put it at any chronic disease, that feels that there is no hope, what would you say to them and where would you direct them?
Yeah, great question. So the first thing I'd say is that there is hope. And the reason there's hope is because all across autoimmune diseases, the common variable or the common factor is the immune system. And there are so many drugs that can modulate the immune system in one way or another. There's diet that can modulate it. There's vitamins that can modulate it. It's just, you might feel there's no hope because a doctor hasn't yet figured out the right thing for you, but there's a good chance there actually is something out there that could modulate your immune system in a way that could really help you. So one is hold on to hope. Don't hold out on hope. Hold on to hope because there is a good chance that there's something out there that could help you. The second is, well, how do you find it? And you obviously need to find doctors who are open to these sorts of maybe non-conventional ways of doing things. A lot of times we feel like the first doctor we see needs to be the last doctor we see, and we need to stick with that doctor. But I'm a big proponent of working closely with your doctor and understanding where their limitations may be, and maybe you can go see someone else that might want to think about things differently. And the third is that within the next year, we're going to be making all of our scores publicly available to the world. So all 4,000 drugs against all 18,000 diseases, so of course all these autoimmune diseases included, which, as we shared earlier, 75 million scores. Those will all be available online at everycure.org by next April, publicly available, freely available for anyone to use. And so any doctor, any patient could look at those scores for their disease and say, wow, Raynaud's phenomenon, like I want to try this drug. This is the number 3 drug on the list. We as an organization recommend that you always your doctor's the one who makes the decision, and we recommend using these scores to guide research and not to guide patient care, but we will be making them publicly available.
Amazing. I'm going to make sure that you'll send that to me and we're going to put them all in the show notes. We're going to put everything in there, and especially your book as well, because I'm very excited to read this, David. It's not often that I have to read it after I interview somebody. I normally read it before, but now I've got so much substance to read this book in the next week, and I'm just incredibly grateful that you've come on and you're sharing your story. The last question I leave with, which is all my guests, which I'm so interested to hear what you'll say to this because you've had 5 times to really think about this, which is, David, what does live well, be well mean to you?
Gosh, it means everything. I think that living in an unhealthy way, just sort of getting by day to day, when you've gone through what I've gone through, it's sort of almost unfathomable. It's like if our heart's ticking, we should be doing it in the healthiest way possible. We should be embracing it. We should be living well. We should be well. If we're lucky enough to be here, we should be doing everything we can to make the most of it. And I just see you doing that so well. You're such an incredible role model for all of us that get the chance to be a part of your community. So thank you for everything you do, and thanks so much for including me on this. And I love this concept, and I hope anyone listening will really embrace this.
Thank you, David, so much. It's a privilege and it's an honor to have you.
So mutual.
And I am so excited to watch your journey. And again, if there's any way that our listeners or anyone on the show can help, please do reach out to David. I'm going to put everything into the show notes.
That'd be amazing. One very tangible thing is every.org/ideas is a place where if you've received a vitamin or a medicine that's helped you for your autoimmune disease or your condition, and you want to share it with us, we can look into it and maybe we can help to get the word out about it for other patients.
That's incredible. I love that you're also building a community,
Yep.
which is something that is kind of a secondary onto what you're doing, but people sharing their ideas and things that have really helped them. Is I honestly believe sometimes we really need to share what we've gone through because we're so individual.
Yes.
And as you said last night, the drug that helps your Castleman's disease might not help somebody else that's got Castleman's disease. So we need to share as much information as we can because we all have such individual systems.
That's right.
And so we will put that into the show notes, and I really encourage everyone to do that. So thank you so much.
Thank you. It's been awesome.